So the most shocking fact about atelectasis, my beloveds, is that it's a single most common cause of fever, the single most common of fever within the first 88 hours, my beloveds, after a major big surgery. And it can often be cured, not with antibiotics, because no infection here, but simply by taking a few deep, correct breath. So after surgery, especially abdominal or chest surgery, patients are in pain. It hurts to breathe deeply and it hurts to cough. Compounded by the lingering effects of anesthesia and pain medication which suppress the natural sigh reflex. Patients tend to take shallow breath. This shallow breathing prevents the tiny air sacs alveoli at the basis of the lungs from fully inflating without being periodically stretched open. These alveoli collapse like tiny wet balloons sticking together. Don't forget about atelectasis. Yes, this is atelectasis. This collapse is atelectasis, correct. So the collapsed lung tissue can trigger a low-grade inflammatory response, causing so-called post-operative fever, post-op fever. A junior doctor might see the fever and immediately think, we've got infection, starting a cascade of inexpensive and absolutely necessary tests and antibiotics. So it's a priming problem, not an infection. The fever is inflammatory, not infectious. The treatment is purely mechanical. Make the patient take deep breaths. So the cure is simple and free. The most effective treatment, my beloveds, is often administered by a nurse or respiratory therapist at bedside. They use an incentive spirometer or just a balloon. So a simple plastic device. What is incentive spirometer? A simple plastic device the patient inhales through to encourage deep breath. These deep breaths generate enough pressure to pop open the collapsed alveoli, resolving the atelectasis and the fever, often within hours. It highlights a fundamental principle. It's a profound lesson in a postoperative care. The simplest interventions, deep breathing, coughing, and getting the patient out of bed to walk, early mobilization, and the most powerful tools to prevent and treat the most common postoperative pulmonary complication, i.e. atelectasis. Understand? Get it? Stay blessed.